Hi, my name is Maria Karina Bersamina. I'm in nursing 355. I have here my patient, Mr. Vang. And today, Mr. Vang, I'm going to be doing an abdomen assessment on you. Put this down really quick. So the first thing I'm going to do is inspect his abdomen. I want to know any discoloration, like purplish, bluish, redness, yellowish. I want to know any dilated visible veins, any stretch marks, scars, lesions, or rashes, which I do not see. Next, I want to take a look at his umbilicus. His umbilicus is inverted. It's not protruding. It's not overly protruding, which is good. And it is at the midline at the lateral line, which is normal. Next thing I want to do is go at eye level and assess his abdominal contour, look for any distension or protrusion, which I do not see. His contour is flat, so that's good. Next thing I want to do is look at his aortic pulsations. I want to know any abnormal findings of exaggerated or vigorous pulsations, which I do not see. I see slight pulsations, which is a good thing. Next thing I want to note, I want to observe for any peristaltic or ripple-like waves throughout his abdomen, and I don't see that either, so that's a good thing. That's normal. Oh, and before we start, if you could just lift your head so that I can see whether anything protrudes. Okay, so that's good. No hernias. Next thing I'm going to do is I'm going to auscultate with the diaphragm of my bell in each of the 4 quadrants. I'm going to be listening for at least 5 to 30 soft clicks or gurgles. And I want to know any hyperactive, high-pitched sounds or hypoactive or absent vowel sounds, which I do not hear. So far I hear good vowel sounds. Now I'm going to listen for any vascular sounds, starting with his aorta. I'm going to listen for any bruits. Now the renal arteries. So far I don't hear any, and that's a good thing. Moving on to the iliac arteries. And then the femoral. So I didn't hear any bruits there. Now I'm going to listen for the venous hum with a bell of my stethoscope over his umbilicus. And I don't hear that either. Now I'm going to go back to the diaphragm of my bell and listen for any friction rubs over his liver. I'm looking for any rough sounds, which I do not know, so that's good. And now I'm listening to a spleen for any friction rubs. And I don't hear any there either. Okay? So now I'm going to start with percussion. And I'm going to percuss each of the 4 quadrants. And I'm going to be looking for anything other than tympanic or drum-like sounds. And I'm going to especially know any dull sounds in his abdomen. Okay, so they were all tympanic or drum-like in nature, so that's good. It shows that there's air in there and no fluid buildup or anything like that. Now I'm going to percuss for the span of his liver, and I'm going to start at the midclavicular line and note where the dullness is. Right there. And then I'm going to start his right upper chest. Okay, so right there. It should be between 6 and 12 centimeters, which it is. And then here at this mid-sternal border, Should be between 4 and 7 centimeters, and it is. Okay, now I'm gonna listen to the left side here for the spleen, and I'm gonna ask the client to take a deep breath. Okay, and I wanted to make sure that it sounded tympanic and not dull when he took a deep breath. Okay, now if you could please sit up. I'm gonna perform blunt percussions to your kidneys. Please let me know if you feel tenderness or pain. Did you feel any tenderness or pain?
No.
Okay. Alright, so now I'm going to palpate, and please let me know if you feel any tenderness or pain, okay? So far so good?
Yes.
Okay, now we're gonna go with deep palpations, and I'm trying to look for any enlarged organs or subtle masses on the organs or around them. So far so good?
Yes.
And I'm gonna test for rebound tenderness. Let me know if it hurts when I release, okay?
No. No.
Okay. Now I'm going to palpate for the liver, and it's easier. It's really, you can't really palpate for the liver unless you're doing it on a skinny person. But what I can ask him to do is take a deep breath. I can hook here, and I feel a little bit of it. It is tender, and it's not hard, which is good. So since I can only feel a little bit, it's not enlarged either. Okay, now I'm gonna feel for the spleen. And the spleen, you can barely feel because it's right there. And that's a good thing if you can't feel it. So now I'm gonna palpate for the arteries, or the renal the kidneys. And these you usually can't feel either. Now I'm going to palpate for the aorta. Like I said earlier, it shouldn't be vigorous or exaggerated in its pulsations. And I feel it. It's a good regular pulsation. Now I'm going to palpate around the umbilicus and note any hernias or protrusions or masses, and I don't. And before we started, I asked the patient to empty his bladder, and so the bladder should be empty. And I'm going to palpate for that and feel a little bit of his empty bladder here. So that's a good thing. Okay, and that concludes our abdomen assessment.